Hi, my name is Mitch Starkman. I am a sports and orthopedic physical therapist, and I have hemophilia. So let's talk. Hey everyone, two quick updates before we jump into today's video. Number one, we have a free giveaway today. If you head over to deskjockeyphysio.com/guide, you can download your 5-step guide of how to set up the perfect laptop home office, which you can do right here, okay? And number two, we are now offering online physiotherapy sessions for you folks out there. To learn more about that, head over to deskjockeyphysio.com/online, and we'll see you there. All right, otherwise, enjoy the video, guys. Thanks for watching. All right, how's it going, everybody? Our question today is, what is the single best thing we can do when we have a hemophilia, muscle, or joint bleed? And the answer to that is simple, and I've done these things for my patients, I've done them for myself over and over the years. The obvious thing is get the treatment that you need, right? Of course, you want to go ahead and get your factor to treat and bring yourself back up to normal. That's of course, right? But in terms of a management standpoint, what is the single best thing you can do? That is one easy answer, that is compression, okay? I have a tensor wrap here. You can get sleeves, all different types. I have a bag full of, different lengths, different sizes, different widths of compression straps or tensor bands. You can take them up from your local pharmacy, but these guys are super crucial to be able to get some easy and effective force and compression on the area of interest. And more importantly, what that will do is decrease the amount of bleeding in the area. So the reason for this, or why this is so helpful, is if we just use the example of a quad contusion, because it's super common. We go ahead and boom, someone knees us in the quad, we have a trip, whatever it might be, and our quad muscle now has a slow bleed in it. We talk about the mechanics that keeps that bleed going in a previous video. But today we're talking about this slow bleed, this cut. You can think about it on the skin slowly oozing out. What we can do is, if we don't get any compression on that, what happens is the bleeding in the area, the fluid will kind of bubble up, and starts to expand and move. The muscle continues to contract because we move our leg, we bend, we twist, and so it will continue to kind of force it more and more out, creates more heat in the area, which in effect will cause more dilation of the blood vessels and create more swelling, more fluid. There's some debate of whether or not ice is helpful in these situations, which maybe we'll talk about in a future video. But here we are, we've got this hot muscle, it's bleeding a little bit, and the fluid is building up. The compression will allow us to take all of that fluid and bring it together. Other thing it does simply is, if you think about a cut on the skin, if we have a cut and we take with big open gash and we take stitches, it will allow us to bring those two sides together and create healing. The same thing is true with a muscle bleed. It's a cut on the muscle to some regard, and we're going to go ahead and compress the two ends of it close together to create the best environment for that healing to happen. So now, while our body's working hard to heal and clot and scab in that area, and we're naturally moving around, we're just going to break a little bit of that scab, the compression is going to work to hold those two sides together, to give it some support. It's going to help decrease that inflammation in the area by sort of containing the amount that can be in there. And third, it feels really good. So a lot of times these bleeds can be achy and painful, and we'll talk about how you have a joint bleed or a muscle bleed in a future video. But it really just feels good and supportive and allows your muscle to activate a little bit more, as opposed to activating through this sort of fray or scab. So the short story is, grab yourself some compression, get that thing on there right away, and then get yourself the treatment that you need. I hope that helps. If it did, please go down there and hit that like button, share it with your friends. Just trying to get the word out there to help people know a little bit more about hemophilia. All the best, guys. Take care and stay well.